for joining us. On this webinar, in which we're continuing the theme of building partnerships with government. In the last webinar that we had, there was a fascinating discussion that brought out the need to think of government not just as a single entity, but operating at different levels. And the discussion also explored the challenge of creating a shared goal of quality with those different entities, those different partners. And if you're joining us today and you missed it, I really do recommend that you do listen to it, and you can find that recording from the Saving Brains Learning Platform website, as you will this one too. So today we're going to continue diving deeply into that issue about partnerships and quality, featuring the work of Babies and Mothers Alive. So thank you, BAMA team, for sharing that with us. And for those of you who've been around a while, you might remember them as also, they used to be known as Brick by Brick. Well, BAMA work in 60, quite a large number, government health centres in Uganda. And they work in partnership with government practitioners and the local community. And they've expanded their primary focus on quality in maternity care by developing and incorporating a more holistic approach to what I would call mother, child, and family well-being. That's my intro. I think I beat my 2.5 minutes, and let me hand you over to Jasmine and Patricia to guide us through the rest of the activities and through the BAMA story. Thank you all again.
Thanks, Penny. And as Penny has shared at the start, she's asked you to think about one word that describes the value that guides your personal relationships. And so we wanted to start with an icebreaker using a word cloud poll. So I'm putting a link in the chat right now, and please click on that link. And once you're there, you'll be prompted to type in a word or more that names what is the core value that guides your personal relationships. So as you're typing, I will share my screen so we can start to see the words that are coming in. So you see love, respect, kindness, trust. So if there's more than one person typing the same word, the word will get bigger on the screen. So you see that respect and trust, those are coming up repeatedly. Trust is huge. Yeah. Honesty. See also dignity, empathy, accountable, integrity, transparency, kindness, generosity, boundaries, supportive, character. I think looks like we've got we've got one more participant typing. We can finish up with this one. That's great. I think looks like trust, respect, love, honesty, mutual respect. Those ones are the top ones. So I will pause here. We have a second question we wanted to ask you. So staying on the same link, you should see this come through now. Now just use one single word. Name the core value that guides the building of working partnerships. So this is when it comes to building your ECD program or networks and government's partnerships. What is the one core value that guides it? So this time you can only type in one word, a little bit different from the first time. Respects, impacts, accountability, open communication, empowerment's goal, accountability, that's coming up as the common one. win-win-win partnership, reliability, impact.
Jasmine, one thing that I think is really interesting about both of these is that the one that's the biggest first was trust, and now it's accountability. But then all the other ones are actually the values that make those the center one possible. I find it's fascinating that both times, trust is built by all of those other values, and accountability is built by all of these other values. So it's really interesting how it worked out that way.
Mm-hmm. It's very interesting observation, Mark. So I'll stop there. We'll come back or revisit this poll at the end of the webinar and see what changes. But for now, I will pass it over to my colleague, Patricia.
Perfect. So thank you, Penny and Jasmine, for that wonderful introduction. Today, I'm very glad to share the story of the BAMA program. It is incredibly inspiring and brave. And when I was interviewing Daniel, Mark, and Eleanor, directors of the BAMA Foundation, I couldn't stop thinking about how mighty it is to empower people to harness the existing resources. But just to tell you a bit more about BAMA, the BAMA program operates in the Rakai and Kutera districts in Uganda. And even though the health system resources are still under high stress, the BAMA team was able to build a joining system with the government health authorities to train and empower health workers in infant and maternal health, reducing the emergencies and complications at birth. And this program has been able to save the lives of thousands of mothers and babies. And by empowering people and developing trustful relationships with the local government, the BAMA program not only makes sure to live install capacities in the district, but develop an innovative service model that could be replicated in other parts of the world. So that's exactly what we would like to discuss with you today. So while you hear BAMA's introduction, please try to reflect on the elements that the story could teach you, but also on how your work could enlighten BAMA's experience and help them create an even stronger program that can be replicated in other parts of the country and why not the world. And this is especially important because after a brief conversation with the BAMA team introducing their program and what they have achieved so far, we would like to invite you to join us in breakout rooms to discuss 2 questions that I'm going to show you right now. Okay, so the first question is, what have you learned from the BAMA story in terms of empowering others and building long-lasting relationships? And what experiences can you share with BAMA that may inform empowering others and building long-lasting relationships? So please have these questions in mind to guide you through this first part of the conversation, and we will go through them in detail in the second part of the webinar. But to start today's conversation, I would like to ask Daniel about the value systems and processes that guide the BAMA Foundation. Daniel, would you like to guide us through them?
Yes, thank you. So we've had a number of values that have guided how we have interacted and worked with government and also with partners. The first one has been building strong partnerships with the district, local government, and also civil society. And through this, we have worked in terms of ensuring that we have a long-term partnership where we are trusted to be there for the long haul. This is exemplified by some of the examples that we have worked on. For example, we've jointly constructed a maternity unit and also a theater. And through the sharing between ourselves and government, we've been able to show, because it didn't happen in the first or second year of implementation, but after we had been there for a long time, they said, oh, well, I think we can be able to trust this team and be able to work together. The other aspect is self-reliance and trusting local talent and expertise. You often find that various NGOs work with external experts, I mean, let's say from the Western part of the world, yet we have local content experts, both in the medical side and also in the social services. So for us, while we started with consultants in the medical field, like myself, we over time built the capacity of our health workers, mainly doctors and midwives, to be able to do things on their own. So we ensured that we skill them to the competence level that was enough for them to work independently. So we harnessed local expertise, and the key issue here is that they understand the context better than anyone, and therefore they're more reliable and in terms of problem solving. So we have a cohort of mentor midwives that do peer-to-peer mentorship and cross-learning across health facilities in addressing issues. Then, of course, we have another value that we cherish and work with, mainly integrity and honesty, especially at institutional level and personal level. And this is one of our non-negotiable values. It defines our image, our authenticity to ourselves and partners. And through joint programming, we share what we plan to do and deliver on a work plan as required. And we deliver what we promise. And one of those is the example I gave earlier, that we said we're going to deliver you a maternity unit, and we do exactly that in a predefined time. And in fact, we have another project we're working on, and the health center community, the community around the health center is actually taking leadership after we had started the fundraising opportunities. Then we have accountability as another major value. And in this value, our program responds to the needs of the district and also government as aligned to the district to national priorities. And as we do that, we agree on the priorities, agree on what they will cost, who the human resource will be, either from our side or from the district, and ensure that we each deliver what we promise. So we have high-level meetings in which we review each other's performance, and this one helps us to see and adhere to what we will have agreed going forward. Of course, you can't talk about accountability without looking at transparency, and transparency is one of those that we also hold in high regard, because we are able to share our successes and also our frustrations, because not everything that you see that has worked well turns out to have happened without any challenges. And especially in this area, working with government and the bureaucracy and red tape, you often find that you'll get into long delays. And these delays or certain policies certain restrictions can affect your work. When we had the COVID pandemic, we have a transport solution, which we call Mama Rescue. We could not move the mothers from home to health facility or from lower level to higher level to deliver. And we had to have a negotiation with the police that was enforcing the lockdowns. And we managed to get exceptions for our teams to be able to deliver this work. We respect each other, and that's one of the values that we hold. And this is across levels of competence, hierarchy, and also across cultures. And in this, we ensure that we deliver our programs with mutual respect. We'll give you an example. We had a time when we have a MAP program, which we call Mama Ambassador Program, that is an adolescent healthcare program for adolescent girls, and we provide mental health services to them, but also monitor their pregnancies and see how this affects development milestones of their babies. And so there is also a government program which is called Group Antenatal, and there's a bit of similarity across how we do this. So one implementing partner in the district was trying to bulldoze health workers not to do our work and do their work. So we handled this in a very mutual way and ensured that through meetings, we're able to come to a common point and address the problem. Of course, we appreciate other value is to appreciate workers, especially those that perform well, and the ones that are lacking in how they do their work, provide support. And in this appreciation, we normally provide non-cash motivation, recognition. One example is we had a health facility where cesarean sections were delayed for long periods. And then when we compared the data with other facilities that we're doing well, we're able to recognize the ones who are performing well. And this caused the other ones to also work harder to deliver on their part. And then, of course, our last but not least value is gender equality. You will notice if you visited us that more than 55% of our staff are women. We work for women and their children, and we have many women in leadership positions. And this, in a way, is one of the strengths that helps us to move forward. So briefly, there's a lot to talk about, but I think given time, these are the few that I can highlight. Thank you very much.
And thank you, Daniel, for that answer. It is very inspiring to hear how you conceived the BAMA program and what you have achieved so far. And I was wondering how the BAMA Foundation has stayed true to those values and systems in these almost 20 years of work. So Mark, maybe would you like to talk about this a bit more?
Yeah, so thank you, Dr. Dan, for that really very comprehensive illustration of our values and how they support our work. I would say that just to follow up on what Dan had said, that one of the most important ways that we have stayed true is to, a lot of times Dan referred to this, that many NGOs, even the NGOs that are working locally, they have a sort of like insider outsider paradigm where they're the beneficiaries and the local stakeholders are the insiders and the NGO is kind of the outsider. They're not fully integrated together. And we have worked really hard since the launching of the BAMA program over 7 years ago to really break that down so that there is kind of almost in the day-to-day work very hard to distinguish between who's BAMA and who is actually a health provider and government staff working alongside with BAMA. So the implementers of BAMA are in fact the health providers, the midwives and physicians who become master trainers and then disseminate their improved knowledge and skills to their colleagues and the community health workers who we raise up and sort of empower as what we call Mama and Papa ambassadors. And they're actually the primary, we would call them almost in quotes, staff of BAMA, even though they're not paid by BAMA, yet they're really the ones who are in the field implementing our quality improvement and mobilization activities to educate the women and families of our districts. So that breakdown of insider outsider, I think, is really, really important. Emphasize again what Dan said about honest communication and self-reflection, and that we, especially internally, but also with our stakeholders, our donors, we're not afraid to acknowledge our mistakes. And when we've tried to do something that hasn't worked, we are very open about it. We've had projects in the past, social enterprise projects that have not succeeded, where we even, lost money with those projects because because we ran into real challenges and they're not successful. And we've done really extensive evaluation of those mistakes and those errors so that we learn from them and found that our stakeholders actually find that a really valuable investment of their money. In other words, even if we have not been fully successful, because we are fully transparent, and that includes our government partners, we build trust, because at the end, our partners are not just institutions, they're human beings. And therefore, when people see, oh, these BAMA, they're prepared to acknowledge their own weaknesses and their own challenges, they're like, we can trust them because they're not holding themselves up to as if they're perfect. So that honest communication is really, really important. The long-term commitment is really essential. In other words, it's not like we're an NGO that's coming with a 3 to 5 year grant and we're going to be here for a while, but everyone knows that when the grant is over, we're going to lift up our stakes and go somewhere else. We are really committed for the long term, and that obviously builds trust, so that people don't see us as an outsider because they see, oh, these guys have been here for 20 years. It doesn't mean we don't have a commitment to scale and to grow, but we still will remain a presence, hopefully a diminishing presence as our government stakeholders take over more and more of the responsibility, but we are always there as a backstop, as a support, as friends, because that's ultimately what we are. We've become friends and partners. And finally, the binational nature of our partnership. In other words, that we have a US-based entity, primarily here for resource mobilization, for fundraising and helping with with grants and government relationships, especially as the US government is one of our principal funders. That binational partnership has really afforded us an ability to stay true to our goals and our values, because the BAMA Foundation in Uganda knows that we have this stalwart partner here that is not going to abandon the organization. And even though it only provides about 30% of the total funds of the overall program budget, it's a very important 30% because it's unrestricted, and it allows for the organization to know, yes, we will still be able to keep our core staff, and the staff know that they don't have to worry that their jobs are ebbing and flowing with a grant cycle. So those are both practical and sort of more large, sort of, I would say, philosophical themes that have allowed us to stay true to our values. Yeah, so that's what I have to say.
Thank you, Mark. It is very inspiring to hear how you have achieved staying true to those values all this time, and how those values have materialized in concrete examples as you show us. And I think you have a video that summarizes really well your program of achievements. So we would like to invite all our participants to watch it while thinking on the values and systems that Mark and Daniel just shared with us.
Hi, my name is Cynthia Rukundo, and I'm the Communications and Advocacy Officer for the Babies and Mothers Alive Foundation. Sub-Saharan Africa accounts for 2/3 of the world's maternal deaths. Lack of access to quality health care for women and children living in poor rural communities is the root cause of this preventable tragedy. Our model is unique as we rely on the expertise of hundreds of government health providers. Our core of mentor midwives are government-paid master trainers who build the knowledge and skills of 300 of their fellow midwives. 150 mama and papa ambassadors, community health workers in the government system, are trained as champions of the health and rights of women and children. Our Mama Ambassador program is a peer support parenting group model serving thousands of adolescent mothers and babies from birth to age 3. We've demonstrated improved early childhood development and maternal mental health. The Mama Rescue Project links women in labor to local taxi drivers through a simple mobile phone app. In 1 year, we've provided transport from village to health center for over 14,000 while linking 1,400 women with emergency transport from health center to hospital. We've screened over 15,000 women for cervical cancer and increased access to family planning. We are ready to scale our innovative BAMA program. Our data warehouse is fully integrated with the government data system with key performance indicators, tracking program implementation and health outcomes. Your support can help turn our vision of quality healthcare for all into a reality. Thank you.
Perfect, thank you. And now I would like to invite Eleanor to talk us about the processes and systems that you have put in place to keep frontline workers motivated, especially because although it is inherently challenging to recruit people and ask them to keep voluntary responsibilities, it was even more difficult in the BAMA context as the available resources make it unrealistic to establish monetary incentives to motivate the health workers. So Eleanor, would you like to guide us through the values and processes that have allowed BAMA Foundation to keep health workers motivated?
Sure, Patricia, thank you very much for that question, which this is a question that we answer most often on the national platforms because the BAMA Foundation has a great cohort of health workers who are highly motivated. And I may say that the biggest factor that keeps our health workers motivated is the professional growth. They feel that the BAMA Foundation, the staff of BAMA are interested in their professional growth. What do I mean by this? We carry out extensive trainings, extensive mentorships. Unlike other implementing partners, for example, they will bring a group of maybe doctors or surgeons or midwives from elsewhere and go to the communities and carry out health interventions. What the BAMA program does is we empower the health workers. We bring in expertise from all over the world. They come and train them so that they can be able to provide these services to the community themselves. So they know that we are interested in their professional growth. They know that we want them to develop, and it's very difficult for a health worker who works 12 hours, a shift of 12 hours. She's alone at the facility. She has not been paid for the past 2-3 months to keep her motivated. But what we do is empowering them. And that brings me to the next point of our mentor midwife model. So we train them and we separate a group of them to be exceptional leaders. We train them extensively. We give them a lot of knowledge, skills, and the skills also to pass on information to their peers, because they're working in the same environment. They have similar challenges. So if it's a challenge of drugs, a challenge of maybe human resource, they know how to manipulate and they know how to work together, but also passing on the skills to their working colleagues. And what does this mean? This means that it creates some kind of competition within the health workforce. For example, if we have, say, a conference, a big conference nationally, it's those people who are performing, usually the mentor midwives, the mentor physicians who are picked out and chosen to go and represent BAMA on the national platform. They end up meeting national politicians. It's the small motivations that pushes them to work hard so that they can be able to perform and outperform others. And then we also do a lot of support supervision. The BAMA model, in a way, we do not sit in our offices and just write and send instructions in the field. We go and work with them in the field. For example, the health system in Uganda has cadres, and there are particular cadres that are not supposed to be carrying out some duties, but because there's a human resource gap, you find that at the health center 3, you find a nursing assistant, for example, is carrying out deliveries. Why? Because there is only one midwife 24/7 for the whole of the year. So what we do, we go out there and we do not segregate her. We bring her on board, train her, and give her the skills that she should use to be able to offer a safe delivery. when we find, for example, the security guards at the facility, or even the cleaners who keep the maternity wards clean, who keep the pediatric wards clean, we respect them, we bring them on board and train them. We find the store managers, we help them how to request for supplies that they need. So we do a lot of training and mentorship at every order, at every cadre, and this helps they feel like we are part of them. We work as colleagues. It's not top to down. So the health workers in the BAMA program go and we hold their hands. For example, I go to the field and I find a medical officer performing an operation, or he has a complication on table. I will not sit and say, well, this is not what brought me. I undress and go in there and work with him. And most of the time, this has been helpful in saving lives of babies and saving lives of mothers. So we also, in the BAMA Foundation, we support a safe working environment for these health workers. Imagine someone who, for example, it's COVID pandemic or Ebola, and they do not have gloves, they do not have cotton, they don't have gauze, they don't have personal protective equipment. That demotivates them. But as BAMA, we usually have a buffer stock. We have some of those supplies that we put on the side. So when we have an emergency, they usually call, or we go visiting them, and then we go and supply. So it helps them know that, okay, even if I have a baby who is going to die, I have this particular drug. Imagine your health worker at the health facility, and a mother comes in with a baby who is fitting and convulsing, and you can't do anything. You don't even have the first injection. You do not have the diazepam to help stop the convulsions. It's very distressing for these health workers. But as BAMA, we have life-saving drugs. We usually have emergency boxes at every facility, and we keep updating them. We make sure that at least a health worker will not be frustrated for failing to save a life of a baby or a child or a mother. And then we also give them non-cash incentives. For example, tea. We provide a kettle. These people work 24 hours, especially the medical officers. They are really understaffed. So we make sure at least they have a kilogram of sugar. There's a kettle, they can boil water and have some tea, and other supplies, other things that motivate them. We have, like Dr. Dan mentioned, we usually have performance reviews where we give awards to the best performers. So this is also kind of competitive within themselves. And we give simple things like a pen, or we give them like aprons, protective aprons with your name, and like it's an award. And these awards are usually handed over by district local politicians. So it helps the health worker feel like, wow, I have been recognized and I have to go back there and do my best. So they kind of compete within themselves with these simple recognitions. And when there's an error, for example, if the health worker has done an error and we bring negative feedback, it is well received, because when it is something good, it is well rewarded. And also we are trusted in the community, in the communities and facilities. They know that we respect their time. They know that we appreciate their time. They come in for training, so we compensate them accordingly. We give them their transport refund. And even if BAMA Foundation per se does not have many resources like other implementing partners, and that one I'm very sure about it, because we have received feedback. The little we give, they are sure that that is what is going to be received. And we do not promise, say others may give them after 5 months, they come for training and they don't have transport back, but they know that at least when we go for trainings and meetings, we shall have our transport, we shall not have to sign very many forms and then don't get the money. So there is that trust. They know that if it is breakfast and it is 5,000 shillings, I will be able to go home and I will be able to receive it. So there's a lot of trust, and they feel like we are working with them. They're our colleagues, they're our friends, and our health workers are also trusted nationally. Our mentor midwife, our senior mentor midwife for the BAMA Foundation, has been a tutor for over 40 years. So she has taught most of the midwives in the Greater Massacre. So they look at her as, this is my teacher. She comes to supervise. She keeps telling them, you know, we learned this way, and they keep motivated in that way. And it helps them to be accountable for each and every action they are taking on a patient, on a mother, on a child and a baby. Thank you, Patricia, over to you.
Thank you, and thank you for that inspiring answer. As I said before, it is incredibly enriching to learn how you have been able to empower the local community. So thank you for that answer. And to conclude this first part of the webinar, I would like to invite Dan to talk about BAMA's partnership with the government health authorities. So Dan, I would like to ask you which values and systems do BAMA and the government have in common? And if you could please share with us some examples of how you've been able to create a joint program with the government health authorities, that would be awesome.
Yeah, thank you, Patricia. And thank you, Dr. Elena, for what you've just shared on what we do. Yeah, first of all, and I think I would like to take this to the poll. You all noticed that accountability was one of those major values that the team picked. And indeed, that is one of our major values that we work with when we're working with government. First of all, we are very well aligned at the policy level with the priorities of Ministry of Health. At the time that we started implementing our program, the ministry had just launched the investment case for reproductive maternal child health interventions, which is also commonly called the sharpened plan. And the ministry now has just finished rewriting the plan into sharpened plan 2. But in both plans, the core interventions that we implement are aligned to what is recommended. And indeed, from policy standpoint, engagement at national level in various high-level meetings, some of which we actually chair on behalf of Ministry of Health, we have this full alignment and a level of accountability that we are jointly implementing the Ministry of Health mandate, but at a delegated level at the district. Some of the long-term commitments that demonstrate alignment with working with government is, for example, the Babies and Mothers Alive program is the core program that aims to reduce maternal mortality and perinatal mortality. And over the years, we have been able to reduce the number of deaths in those two districts by up to 72% over the last 5 years. And when you look at perinatal mortality, a reduction of around 32% over the years. And this is in line with the procedures and the interventions that Ministry of Health does. And we also engage the national platform in policy development reviews. And we now have this weekly maternal and perinatal death review meeting, some of which meetings I chair. And then you can see that at that level, sometimes you forget your identity. You like, hey, maybe I'm government, maybe I'm Babies and Mothers Alive Foundation, but that is how close we have managed to build these relationships to work together. The other example, of course, is the adolescent health program. And you know that adolescent issues are an issue in this country. And so the MAP intervention, as well as the MyPads intervention, are these two interventions that are addressing adolescent health. MAP for the girls that have gotten pregnant but would like to take care of them and prevent them from getting another pregnancy when they are still teenagers. Then the MyPads is the comprehensive adolescent health program for girls who are in school or out of school but are not pregnant. And then we have also integrated our data systems such that when in real time we can access data either from the Ministry of Health DHIS2, but we also analyze and feedback analyzed indicators that can be used for decision making in all the meetings that we do, but also at national level. When you look at the map for maternal and perinatal death reviews that are run quarterly, you will notice that Rakai and Chotara districts definitely have a better performance as compared to the other districts within the Greater Masaka region. As implementers, we implement government mandate. We also collaborate with other partners that are in the region. But generally, our focus being maternal health, we have generally been amongst those that provide that focus. And so we look at our work as complementary. We do not implement outside of the recommendations, but the fact that we work with the district health workers that Dr. Lina described fully, you will notice that we provide catalytic support, and then the rest we work with the district staff. And this is one way that we are working towards sustainability of this programming, just in case there are constraints in financing. And thank you, Mark, for putting in the chat the link to our programs. Colleagues, feel free to click on those and read at your leisure when you have time. Thank you very much. Over to you, Patricia.
Perfect. Thank you, Daniel, for that answer. Yeah, it is very exciting to hear how you developed this joint program with the government and the positive impact it has had in Uganda. So now I think it's time to pass to our second part of this webinar. And we would like to invite you to join some breakup rooms. Jasmine is going to help us moving us to different breakup rooms. And in those breakup rooms, we would like to discuss these two questions, that the questions we shared with you at the beginning. So we would like to invite you to start thinking about these answers, and yeah, and in a couple of minutes, we will be joining the different breakup rooms.
That's good. I've just put them in the chat as well too. So if you forget the questions, you can open the chat and see. And then, so now I will open the breakouts.
Okay, so I think everyone is back now. Thank you everyone for joining us in the breakup rooms. And it was very interesting to hear about all your different experiences and how you have developed different strategies to empower people and make bigger changes. So in the last 10 minutes of the webinar, we would like to invite BAMA to tell us about the main takeaways they got from their discussion in the breakup rooms. And we would also like to invite all the other innovators joining us today to put in the chat the key lessons you got from this webinar and the breakup rooms while BAMA is speaking. So maybe you can start with your reflections then, and then we can move to Mark, Eleanor, and Michael, if that's okay for everyone. So Dan, would you like to summarize the main takeaways of your breakup room very briefly, maybe in 2 minutes, 2 minutes and a half?
Yeah, thank you. I think we've learned that we need to document our work. We need to have comprehensive programs. We also need to think through sustainability. Also, I think there's another addition to work with the faith-based religious leaders through the training of in the seminar. I think that was the new one that we haven't been doing, even though we are engaging faith-based leaders. Thank you very much.
Perfect, thank you, Dan. And Mark, do you want to share your key takeaways?
Yeah, so it was really, really valuable breakout session, really interesting input. Interestingly, there was a big focus on our building our research capacity so that we can very definitively prove that our intervention is really causing the improvements that we're seeing. And we know that turns out that some of our biggest donors, US government, are really encouraging us to do that as well. And that came up with several of the innovators in the breakout room. So we are really, it's really interesting that when we get to this point in our development, when we know that what we're doing is very, very powerful and that it's had a real impact, and yet we see that there's a need for us to be able to really kind of ground it more rigorously, the data, so that people can trust, people who don't know us so well, can really trust that that we are actually accomplishing what we say we're doing. So that was a big focus of the session, and also to map out stakeholders. It also, coincidentally, we are doing stakeholder mapping with GCC, so it works out that a lot of the input was also about that, to make sure that we're not duplicating services especially as we scale. So that was another big take home that was really valuable. So yeah, thank you.
Perfect. Thank you, Mark. So now, Eleanor, would you like to give us a very quick summary of the main lessons you got?
Yes, thank you, Patricia. It's not very different from what Dr. Dan mentioned, but I attach a name to who mentioned what, so that it helps me remember. So Manlik and Chiseche mentioned something to do with documentation and also faith-based leaders and a curriculum. So like what Dr. Dan brought up, the faith-based leaders, even if we're engaging them, we need a curriculum, and also engaging them where they work. But also James mentioned something to do with sustainability. In as much as we are working, we need to keep thinking about it. Even if you're moving in the right direction, let it not stop to think about sustainability. And then Rina mentioned something very important, that even if we're engaging the young girls and all those groups, it's also important to bring out the area of nutrition. It may be there, but we need to re-emphasize it. And that is something that that has come out very clearly, and a very good point for the BAMA Foundation. Thanks, Patricia.
Perfect, thank you. And finally, Michael, would you like to add some additional reflections?
Thank you very much, Patricia. My big take-home message is centering our way of, I think this was brought in by one of the colleagues from Rwanda, who indicated that actually we need to use the data and interest government agencies or government partners to uptake part of the data, and we see that actually the research arm develops as expected. So my takeaway lies around there, in addition to what Dr. Mark says.
Perfect, thank you. So yeah, thank you everyone for reflecting on how we could have a greater impact on ECD from our different positions and institutions. And so before finishing this webinar, Jasmine, would you like to guide us through the last activity we have for today, our final survey?
Yeah, thank you, Patricia. So we would like to revisit the poll that we did at the start. So I'm putting in the chat again the link to the poll. And so click on that link. And now we're asking the same question. Using a single word, name the core value that guides the building of working partnerships with you for your ECD program, for your work. And let me share my screen so we can see the results as they come in. Empowering others, transparency, trust, shared purpose. I think this is already starting to look a little bit different from the first time. Inclusion, high level commitments, transparency. Got a few more coming in. Honesty, consistency, empathy, inclusion. It's very interesting. Yeah, this is, it looks like we have shifted something during the course of the webinar. I think we started off, I would just flip back so we can take a look at what was here before. Before we had accountability at the start, at the very center. And I think, as Mark observed at the start as well too, that what guides personal relationships, a lot of it is centered around trust and honesty, respect and love. And at the end now, we're around working relationships. Trust is coming back up for front and center. commitments and transparency as well too. So very interesting. I'd like to, thank you as finally again to the BAMA team, Michael, Eleanor, Dan, Mark, and then I understand we also had Sister Assumpta join us as well too, who's a senior mentor midwife. So thank you, BAMA, for sharing your stories, and thank you for everyone for participating in this webinar and engaging in the breakouts as well too, and sharing your experiences. This webinar recording will be shared, and we'll upload it onto our Saving Brains website, and I will send an email also along with a written case profile for the BAMA team. I think, and Dan, speaking to your points about having this documented, we'll have a case profile documenting BAMA's work as well. So look out for an email from us. And then wanted to share as well, our next webinar is taking place on November 9th, on a Wednesday at the same time. Actually, we have Ha on the call as well from the Early Journey of Life team in Vietnam. So Ha and the Early Journey of Life team will be sharing their experiences partnering with governments and looking at it from at national level, how to engage governments at national level. So I hope to see you again soon on the webinar, and thank you everyone again.
Yeah, so yeah, I think that's everything for today, but I really hope you have enjoyed this conversation as much as I did. And yeah, we hope to see you soon in our next webinars. Thank you so much for joining us, and thank you, BAMA, Penny, and Jasmine, for making this conversation possible.
And thank you all on behalf of the BAMA team. Thank you all for everything you've shared, and it's really, really, we really appreciate it. So we're very, very grateful, and thank you to the learning platform. It's, you know, I've said this before, but it's very nice to have the funding from Grand Challenges, but to be honest, the community support and the expertise and the love and care that the learning platform puts in over these last many years now has almost been more valuable than the money. So we're very, very grateful for everyone's contribution. So thank you.
Thank you, and bye everyone. See you again in the next 2 weeks. Bye.